In this procedure, I will demonstrate placing a Tafelmeyer retainer and matrix band on a molar tooth which has a class 2 cavity preparation. A wedge will be used to recreate the embrasure space between the missing tooth wall and the adjacent tooth. Here are the parts of the Tafelmeyer retainer. This is the outer knob. It is used to tighten the vise which holds the matrix band. This is the inner knob. It moves the vise and makes the diameter of the matrix band smaller or larger. This is the vise. The ends of the band fit into the slots of the vise. These are the guide slots to move the looped band to the right or left, depending on the tooth to be restored. Here are 2 retainers set up with the band exiting through the right and left guide slots. Holding the retainer, place it on the facial side of the tooth to be restored. The guide slots always face towards the gingiva. Push the band gently over the crown until seated. Tighten the inner knob to tighten the matrix band firmly on the tooth. Check that the band is stable. Using college pliers, choose a wedge and hold it with the base of the triangle in position towards the gingival margin. The wedge will be inserted on the lingual aspect. The wedge is only needed on the side where the tooth wall is missing. Now the tooth is ready to be restored. To remove the band, first remove the wedge with the college pliers. Unscrew the outer knob to release the band ends. Remove the retainer, keeping the bands in place around the tooth. This helps to prevent the filling material from crumbling interproximally. Gently remove the band with the college pliers, one end at a time. Floss the interproximal area to remove excess filling material.
The tooth crown is the part of the tooth that is visible in the oral cavity. In layman's terms, the artificial covering that is fixed over a damaged tooth is called a dental crown. There's a difference between the functional and aesthetic characteristics of a crown. An artificial crown should always achieve the functional aspects, in effect the right fit against the opposing teeth, as well as in the socket. This is the primary responsibility of the dentist. On the other hand, the aesthetic appearance is the primary responsibility of the dental technician who fabricates the crown. The price of a dental crown has little to do with the materials used, due to the small quantities that are used. With regard to durability and biocompatibility, there are no differences in the materials. All used on humans go through a complicated approval process. The price is directly related to the working time and effort required. This picture illustrates an aesthetically pleasing crown, which is not identifiable unless pointed out. This picture illustrates crowns on the upper teeth, which can be distinguished right away as artificial. Here's the difference between the two. In the first picture, the ceramic has been coated, which means that the patient sat by the dental technician, who laboriously painted onto the ceramic layer after layer until it matched the original teeth. The translucent effect of the tooth can thus be recreated. Not every technician can master this technique. Recreating a beautiful crown is an art. The crowns in the other picture have been made out of a prefabricated shell, and they have been painted according to the color indicated by the dentist. The technician never saw the patient. This is quick and less time-consuming, and so costs less money. Differences between dentists do exist with regard to the fabrication of crowns from the functional point of view. This is why some crowns last for 30 years or more, whereas some last for only a few years. A crucial factor for durability is the manner in which the tooth was ground or cut by the dentist. A quick and easy way is the so-called tangential abrasion. The tooth is simply beveled. The disadvantage of this technique is that the technician has to leave a certain residual thickness of the ceramic while fabricating the crown, otherwise it would break. The result is ugly, overlapping, lumpy edges. In order to hide these, the crown margins are prepared below the gum margin, the gingival margin, because of which a dental probe and/or dental floss can get stuck on the edges of such crowns, as can food particles. These food particles cause inflammation of the gingiva, or gingivitis, with recurrent bleeding. As the years go by, the constant inflammations leads to recession of the gingiva. The edges of the crown therefore get exposed, and the risk of developing root caries is now increased. Another possible technique for crown cutting is the so-called stepped abrasion. This is also a relatively quick process. Unfortunately, the adhesive does not flow very well during cementation, creating a wide joint in the glue. As a result, there is a risk the adhesive, usually cement, can get washed away with time, for example by brushing. This will once again increase the risk of root caries. In the round margin abrasion technique, the advantages of the other techniques are combined and the disadvantages are eliminated. However, this technique is the most complex. The adhesive can flow easily during cementation. This allows for a thin joint. The technician has enough room for the ceramic and the edges are tightly closed, preventing food lodgement. To achieve a round margin, cutting must be performed under magnification. Furthermore, particular criteria must be observed while taking the impression. For example, before the impression is taken, 2 gingival retraction cords should be placed, one of which should be removed just before taking the impression. There are various pastes that can replace the gingival retraction cord, but sometimes these chemicals react with the impression medium and can cause distortion. The result will be an ill-fitting crown. Why are gingival retraction cords necessary? First, because the gingiva must not be cut, and second, because the preparation margin should be placed in the so-called sulcus, in effect below the visible border of the gingiva. The first gingival retraction cord deflects the gingiva to one side in order to avoid injury while cutting. It also ensures that the preparation margins are placed in the sulcus. Fair enough, but why 2 gingival retraction cords? Once the technician pours plaster into the impression, this creates a plaster model of the teeth. Because the margins of the prepared crown must fit tightly along all the edges, these edges should be clearly visible to the technician in the impression. Therefore, the impression material should flow right up to the preparation margins. By laying the second gingival retraction cord, the gums are deflected in the other direction. When the second gingival retraction cord is removed just before the impression is taken, the impression material will clearly record the preparation margins. On the right of this animation, the preparation margin is clearly visible. On the left, the consequences of not using ligatures can be seen. The plaster mold does not correspond to the prepared tooth as the impression material has not recorded the preparation margins. This could be because of the presence of interfering gingiva and/or blood or saliva. The technician will unknowingly prepare an ill-fitting crown. Although many other factors contribute to a good crown, the working methods described here clearly show why the quality and price can vary so much. A good crown does not cause inflammation or recession of the gingiva. It is indistinguishable from the original tooth and lasts for decades. Even if it needs to be replaced, the underlying tooth stump will always be in good shape. There can be certain alternatives to tooth crowns for restoring a damaged tooth. In cases with high aesthetic requirements, veneers and/or bleaching may perhaps be a better alternative to a crown. If tooth alignment is an issue, then braces come into the picture. The particular risks when crowning a tooth are as follows. Death of the nerve or pulp if, for example, the tooth is excessively cut. The consequence is a root canal treatment. Injury to the neighboring teeth, mucosa, floor of the mouth, tongue, or cheeks. Gingival problems or receding gingiva, especially if preparation margins are incorrect or if the gingiva is injured while cutting. Dentists refer to this as injury of the biological areas. And finally, an incorrect bite, painful jaw joint, or headaches if the bite is unintentionally altered by the newly crowned tooth.
Hello, today we're going to be talking about CAD/CAM dentistry. In our office we use the Sirona Cirac computer. And what this machine does, it gives us a digital image of the teeth. And that way we're able to make a crown in the office. So let's go to our model so we can kind of see what the prep of a crown looks like. This was a crown that was already on there and there was recurrent decay. Removed the decay and it was pretty excessive. And let's look at our design to see what it looks like. So this is what the computer gave us. And it gave us a pretty good makeup of what the crown should look like. And what we can do is we can actually see what the upper jaw looks like hitting the lower jaw. And that way we can make sure that the bite fits right when this unit is milled. So once the crown is designed on the computer, what we do is we send the information over our wireless network to our milling unit right here. And we place a all porcelain block, as you can see here, into our unit. So here is another one right there. And what we do is we press OK, and the unit starts going. There's two diamond drill bits that will cut the block into the shape of the crown that the computer has designed. Once the milling machine completes the crown, we take it out and we'll either hand polish to high shine or we'll put some glaze and throw it in the oven to give it a little extra strength. As you can see, this crown has a nice shiny high polish. What we'll do is we'll cement the crown, and in these next few photos you can see some inlays, onlays, and crowns with before and afters. This whole appointment takes about an hour to an hour and 15 minutes from start to finish. So no more temporaries, no more worries. You're done in one appointment. All thanks to CAD/CAM dentistry. Thanks for watching the Dental Channel. We'll see you next time.
I will demonstrate the process of making a provisional or temporary crown using a polycarbonate crown form. This crown form comes in all tooth shapes and reduces the amount of trimming that must be done later to replicate the missing tooth structure. The polycarbonate crown form does not fit the prepared tooth. We will line it with a material that fills in the crown form and fits the prepped tooth. Trim the polycarbonate crown to fit the prepared tooth by cutting at the gingival margin. Leave the tab at the incisal edge. This will help in removing the crown form. Coat the tooth preparation with petroleum jelly to prevent the lining material from sticking to the tooth. The methyl methacrylate lining material is also irritating to the skin, so you must wear gloves. To mix the lining material, dispense liquid monomer into the Da109 dish. Add 3 times this amount in powder and cover the liquid surface evenly. The correct ratio is 1 part powder to 3 parts liquid. Add additional powder to make a thick mix. The consistency should be creamy and sluggish. The material has a working time of 2 to 3 minutes from the start of the mix. Fill the polycarbonate crown with lining material. Insert a plastic instrument to the incisal edge of the crown to eliminate air bubbles. Allow the lining material to set for 30 seconds until the surface is dull. Place the polycarbonate crown over the tooth preparation and hold it until it reaches a rubbery stage. An extra piece of lining material kept outside of the mouth can be used to determine when this has happened. The lining material has an exothermic period lasting 4 to 7 minutes from the start of the mix. It is important to remove and replace the temporary crown during this period to prevent thermal injury to the pulp. Allow final hardening outside of the oral cavity. An acrylic burr on the slow-speed handpiece can be used to trim excess resin from the gingival edges. It is also useful to remove some resin from the interior to allow space for the cement. In order to cement the crown, we will be using zinc oxide eugenol in a paste form. If the final restoration will be made of composite material or cemented with composite-based cement, then you must use non-eugenol temporary cement. Rinse and dry the temporary crown thoroughly and remove the incisal tab. Clean the petroleum jelly from the tooth preparation. The tooth can also be polished with pumice. Extrude equal amounts of zinc oxide eugenol in paste form onto a small mixing pad. Mix the base and the catalyst together all at once until homogeneous. Gather cement onto the tip of a plastic instrument. Coat the inside edges of the temporary crown up to the gingival margin. Do not fill the crown entirely with cement, or air will be trapped and excess will flow out when placing the temporary. There is a 2-minute working time with the temporary cement. Seat the temporary crown on the prepared tooth. A patient would be instructed to bite gently on a cotton roll for 2 minutes. For the typodont, we will hold it in place with our fingers. An explorer or a universal scaler can be used to remove excess cement from the gingival margins. A piece of floss with a knot can be used to remove interproximal cement. The floss should be pulled through the contact and not pulled incisally to avoid removing the temporary crown.
Once you have your new dentures, you might be wondering how to take care of them. At first, you should wear your dentures all the time, even at night, to adapt to them more quickly. After you have become accustomed to them, we recommend that you take them out at night. Cleaning your dentures every day is one of the most important things you can do to keep your new smile looking its best. If you don't, plaque can form on dentures, making them less bright. Failure to regularly clean your dentures can result in staining and denture odor as well. So, here are a few simple tips. Dentures can break, so always fill the sink with water, then clean your dentures over the sink just in case they accidentally slip out of your hands. Rinse your dentures thoroughly to remove loose food particles. Use cool or warm water. Never use hot water. It can warp your dentures. Apply a denture cleaning paste to a moistened denture brush or a soft bristled toothbrush. Do not use ordinary toothpaste, bleach, or vinegar unless directed to do so by your dental professional. Brush all surfaces thoroughly. Avoid using brushes with stiff bristles as they can damage the denture material. Rinse your dentures well under the faucet to remove all traces of cleaning paste. While you sleep at night, soak your dentures in water or in a denture cleaner. Last, brush your gums, tongue, and palate with a soft bristled, regular toothbrush to remove plaque and stimulate circulation.
For a denture to fit and work well, you need to work at adjusting to it. No denture ever fits and feels natural from the first day. Would you be able to walk in new boots made out of hard leather? You probably would get some sores. And once the skin toughens up and the sore areas adjust, it all works out. Dentures are similar, except they need more time for acclimating. For success, you need to commit to keeping the denture in your mouth for as long as possible for the first few weeks. This is so your mouth learns to adjust. Keeping the denture in your mouth also helps identify the areas that are sore from the denture pressing and need additional adjustment by the dentist. It is important to visit your dentist to adjust your denture 48 to 72 hours after receiving it. You will receive another adjustment about a week or two later. Even if you are handy with a nail file or a Dremel tool, you should never attempt to make your own adjustments or repair the denture at home. Let your dentist adjust the denture. While dentures are an adequate replacement for your missing teeth, you should not expect the dentures to have the same chewing efficiency as your natural teeth. Initially, wearing the new denture may cause new sensations and increase amounts of saliva in your mouth. Both of these are normal because your mouth is adjusting to the new appliance in there. The saliva increase should subside as you and your denture adapt to each other. You may also accidentally bite your cheek, lip, or tongue. This happens to almost everyone. It is normal to develop some sore spots after wearing the denture for a few days. Please visit your dentist for all necessary adjustments of your denture. You should avoid eating hard or sticky food for the first few weeks. Try breaking your food into smaller pieces. This will make it easier to chew. Chew with your back teeth instead of your front ones and try to balance the denture by chewing food on both sides of your mouth. Try to practice speaking, as wearing dentures normally change the way you pronounce some words. Reading out loud for 15 minutes twice a day. Practice makes perfect. If you hear a whistling or clicking noise while speaking, try speaking more slowly. If these problems persist, visit your dentist. Dentures, like everything else in your mouth, require cleaning. First, remove your denture from your mouth. Brush your tongue, gums, and palate to clean the area as well as increase the blood circulation in these areas. Next, clean the denture using a denture cleansing paste or liquid soap with a soft denture brush. Rinse the denture with warm or cold water. Stay away from using hot or boiling water. It will warp the denture and it will not fit. The denture needs to stay moist at all times, so at this point, place the denture back into your mouth or soak it in a cleansing solution overnight. Be sure to avoid using a regular toothbrush and toothpaste on your denture. They scratch the teeth and cause scratches that collect food and cause discoloration. You can use a denture adhesive for better retention of your denture. Do not use an adhesive on a loose or denture that doesn't fit well. A loose denture may require a reline or other repairs to improve its fit. Be sure to visit your dentist as directed, or at least visit once a year even if everything feels fine.